Should I get breast implants with my lift or not? Well, let's talk about all the benefits and drawbacks of getting breast implants with your lift. First off, let's cover what you're able to do when you do get breast implants with your breast lift. One of the main advantages is that now you can increase the size of your breasts if you wish. There are two ways to do that. One is with volume, or the overall cc's of the breast implant, and the next is the profile of the breast implant. Breast implant profile is what describes how much a breast implant will stick out from your chest. Breast implants come in low, moderate plus, and high profile shapes. You can kind of think about it starting from a low rolling hill in the low profile to, I don't know, Mount Everest as the high profile implants. But the main thing that you'll get with breast implants is fullness in the upper pole of the breast, creating a more rounded shape. That upper pole fullness can also come in two different looks: a more full and definitely augmented look with placement of the breast implant above the muscle, or placing it below the muscle to give a more natural slope to the upper pole of the breast. But what if you don't want any implants placed during your breast lift? Well, that has some benefits too. For one, it keeps the procedure more straightforward and gives you a totally natural look. There's less risk of complications too, since the surgery requires less time in the operating room and less tissue to be cut for the surgery itself. Mammograms are also a bit more straightforward, as the radiologist can use standard views for the imaging rather than what's called the Eklund views, where the implant has to be displaced kind of back and up during a mammogram to allow for better visualization of the implant. Another benefit of not getting breast implants is the decreased cost of the surgery. Since breast lifts are considered cosmetic, they are not covered by insurance, so this surgery is paid for out of pocket. If you aren't getting breast implants during your lift, it cuts down on the time in the operating room, and there's no cost for breast implants, so the overall cost is less. And even if you don't get breast implants during your breast lift, you can always come back later on and have them placed if you wish. Then what are the drawbacks of not getting breast implants during your breast lift? Well, not a lot. Like we talked about earlier, the only thing you won't get is fullness in the upper pole of the breast that a breast implant can create. Now, you can use your own tissue to help create more fullness in the breast, and this is done either by folding some breast tissue up underneath the nipple or upper pole of the breast, or even fat grafting after. You'll appear fuller in the upper pole, but in my experience, you won't have that augmented look to your breast long term if that's what you want. But what about the drawbacks of having breast implants with your breast lift? There are a few, but with an experienced surgeon, these can be managed pretty well. To start, breast lifts with implants are a bit more complicated. Instead of dealing with a vertical vector with the lift, we now have to consider the horizontal vector that the implant causes the breast to stick out from the chest. With these two components, I, as your surgeon, now have to make calculated decisions as to where to make the opening on the breast mound so that I can predict where the implant will settle and allow the nipple to sit just at the most projected part of the breast mound. This two-vector component increases the risk of needing a revision in the future a bit to readjust either the implant or the breast tissue itself. The other aspect is the scarring on the breast. If a larger, higher projecting implant is placed, then we get more tension on the wounds. More tension on the wounds can often lead to more visible scarring. However, there are a lot of components that go into how a surgical scar heals after surgery, so tension is not the only one. Also, breast implants are not lifetime devices, so there will be a point in your future that you will need to have your breast implants replaced. So how do you decide? Breast implants or no implants with your lift? I'll tell you what I always tell my patients. You need to decide ultimately what's best for you. If you want to have fullness in the upper pole of the breast and feel like the risks are reasonable, then go for it, as long as that is what's going to make you happy. If you're concerned about implants or want to decrease the risk of needing more surgery in the future, then you can skip the implants. This video is meant to help educate you on your options so you can make the best decision for yourself without any misconceptions. And speaking about misconceptions, if you want to learn all about the 5 most common misconceptions about breast lifts, then you can watch this video right here. I'm Dr. Paul Pearce. Hope you learned something today, and I'll see you on the next one.